Hi everyone, my name is Yulia and I'm an acute care nurse practitioner. I see that there's lots of questions from current or future students, nurses who want to be nurse practitioners, and they're questioning whether to choose primary care, adult care, family, or acute care nurse practitioner. It all depends on your area of practice and what you want to do in the future. I have been a nurse for 6 years. I started on a trauma floor for several months, and then I decided that I need more experience, and I started working on the medical floor because we managed a lot more chronic conditions on the medical floor than on a trauma floor, which was basically on the trauma floor was pain management, nausea management, and wound care. So I mastered those skills and then moved on to managing more chronic conditions. And I started working on acute care floor. We had anybody you can imagine, from psych patients, alcoholic withdrawals, drug withdrawals. We managed a lot of COPD, heart failure patients, GI bleeds. It was a variety of diagnoses on that floor. That's where I gained most of my experience. And a couple of years into my career, I decided that I can and I want to do more than just being a bedside nurse. And I decided to pursue a nurse practitioner career. From the beginning, I knew that I did not want to do an office setting. So I knew that I will begin a nurse acute care program so I can stay in a hospital after graduating the program. And I started looking for programs, and fortunately I had a couple of friends who were working with me, went to University of South Alabama, and at that time there were still students at the nurse practitioner program, and they recommended me this program. I had some notes from them. They advised which classes are better to take, and it was very easy for me to get into the program, fortunately. And I started as a part-time student because I have 3 small children and I need this work-life balance. It was not as important for me to finish school faster as to have quality time with my family and take my time with the school. I also wanted to continue working. At that time, I was working nights on my acute care floor, and total it took me about 3.5 years of school. First summer I took off. I went to visit my family overseas, and then throughout the program I never took more than 2 classes, so it gave me great balance. I could have evenings with my family, study during the day, or do some basic reading at night when I was working nights, when we had downtime, quiet time. So it worked out well for me. And throughout the school, I was sure that I will be doing cardiology, because most of our patients had cardiac conditions, not most, but majority. And I was talking to my nurse practitioners who I worked with, to the doctors, and I was pretty sure that I will stay with the group I was working with as a nurse. After probably 4 years of working nights, I realized that it took a great toll on my body and on my mental well-being. And I told myself that I will not do nights anymore. During my last year of school, we had clinicals for 3 semesters. We had to do, I believe it was 6 specialties. We had to have a primary preceptor, which had to be either hospital medicine or pulmonology. I know some students picked trauma because this was their area of specialty, and this is what they will be doing in the future. So it all depends on your program director and how you will work around it. So I had my hospital NP. Your preceptor has to be an acute care certified nurse practitioner or an MD. They will not, I want to say, they might accept a family nurse practitioner, but you have to sign a waiver, and this waiver will be, it will say that it will depend on the board's decision during your licensing process, whether they will accept this rotation or not. So I decided not to take a risk. Yes, it was easier for me to pick a family nurse practitioner. There was abundance of those in my hospital, but I managed to find ACNPs or MDs as my preceptors. So total I did 3 semesters with my hospitalist NP. First semester we had to do 3 rotations, which was hospitalist, pulmonary, and cardiology rotation. 60 hours each. Second semester, I did nephrology and hospitalist. And during my final semester, I did hospitalist. I chose another nephrology rotation. I will tell you why later. I also did ID and trauma. Yes, ID and Hem-Onc ID was a required rotation. So I'll tell you why I chose 2 semesters of nephrology, because the group I wanted to work with, their main, the head doctor said that as a new NP, you have to do nights and weekends, or either or, but it will be nights for a short time, but you will have to do nights, which was a big no for me already. And during my summer rotation, I was with a nephrology preceptor who showed me around the dialysis centers. We went to clinics, we did rounds in ICU on the floors, and I started liking it, which was surprising for me. But I started seeing myself as a nephrology nurse practitioner there. And already in June, 2 semesters before my graduation, he told me, just giving you a heads up, whenever you're done with school, whenever you graduate, just let me know, I'll give you a job right away. So I started considering that, but there are 4 doctors in the group, and I wanted to see how other providers work, just to be sure that we will be able to work together as a group, because I might have to go to other hospitals and work with other providers. So this is why I asked my program director to squeeze another nephrology rotation for me in my final semester. So during my last semester, I did another 60 hours of nephrology with another 2 providers, and made a final decision to apply with the nephrology group. They had a nurse practitioner that they were about to hire at that time, but when she was going through hospital accreditation, one of the hospitals told her that she could not start working there because her program was not acute care route. So she was a FNP. She was family nurse practitioner. And first thing that the other doctors, nephrologists, asked me, what type of program are you taking? Is it acute care or just adult care or FNP? I said, mine is acute care because I know I want to be working in a hospital. And this is why I picked the route from the beginning. So that helped me in my career choice, and it made it easier for providers to work on my accreditation. So right now I'm working, I'm still working as an RN on a solid organ transplant unit while the paperwork is still in process. It takes anywhere from 90 to 180 days, from 3 to 6 months to get accredited with hospitals. I'm applying with 5 different hospitals because this is where my doctors are rotating, and I already got accredited with dialysis centers. It was much faster than hospitals, and I'm starting with them in a couple of weeks, which is very exciting. I love my bedside job, but it's becoming very, the patients are demanding and it's becoming more physical. So I'm thrilled to become a provider and start a new chapter of my life. If you guys have any questions about a program, about rotations, about the school choice, because I was looking at other schools as well, send me a message. I'm just starting this channel. I have another channel which has a lot more personal stuff. I didn't want to mix it. So I will be here. I will be posting more videos with answers. And I will record another video with the test preparation. So I'll be waiting for your messages and questions. Bye, guys.